Morning everyone, it's Ian, Keith, Dad, Grandad. Don't know what to say to this morning. Well, I probably woke up about 3 o'clock, which they reckon is the suicide time, 3 a.m, when it's most common of people killing themselves. Oh, what a subject anyway. Yeah, bad day yesterday, long day. Where should I start? Don't know really how this is going to go. Well, yeah, firstly, TERP, it's going well. I'm peeing brilliant. Oh, it's marvellous. I forgot what it was like. You know, when you, and men will understand this, women won't. When you pee in, real good stream and then you die down and then you get another little squirt. I hadn't had that for years. It's marvellous. But with a TERP, when I start to empty my bladder, it starts to hurt because obviously everything's coming together because the urine's flown out. Yeah, so it needs to heal. And from what I'm reading, it's saying 3 to 4 weeks, total light duty. Don't lift anything heavy, don't do anything strenuous, no exercise. Short, gentle walks. And take it easy, basically. Don't push anything heavy as well, it said. Bit difficult when it just took my wife to hospital in a wheelchair. Anyway, I took it easy. Yeah, I passed, and again they said this would happen, I passed a scab, probably about 10 millimetres diameter. No problem, it just popped out. I felt it go. But then a lot more blood. I mean, I was settling down quite a bit. This was about 2 days ago. And they say keep drinking plenty of water, because obviously, I mean, there's going to be a fair amount of scabs to come out. And you've got to flush them out. 4 o'clock in the morning. Yeah, so I've been bleeding quite heavily. And what happens is that blood settles down to the bottom of your bladder in the urine because it's heavier. So when you pee, initially, it's blood. And then the urine starts and it flushes it all out, which is good because you don't want the blood to clot inside your bladder. So you've got to keep peeing regular to keep flushing it out rather than letting it solidify, because that will give you a big problem. Yeah, so it's going well. I'm only just over 1 week. I'm on my 8th day now, I think, since my TERP op. It's probably been the right decision to improve my quality of life, which is going to be a big topic this morning. Yeah, so I know my brothers and sisters will be watching this, and my kids and grandkids. Well, I don't know about the grandkids, and friends. Yeah, so a bit of a Debbie Downer, as they say. I'm going to have a quick slurp of my tea. World's greatest Grandad. Yeah, so anyway, as you all know, I was due at hospital yesterday to get the results of my PET scan. And I've notified most of you as best I can with WhatsApps and things, emails. So sat about, got there early as usual, make sure I'm on time. I'm a bit of a nerd like that. Yeah, I like to be punctual. So I sat there, waited probably half an hour or so, and in walked the consultant. And I'd done me, as I said to him, the due diligence. And I'd looked him up and I'd sort of sussed this guy out. Turned out he's Irish. And you know what Einstein's like with hair all over the place? Well, he's a bit like that. He's only a sort of mid-30s, early 40s guy. Obviously intelligent, switched on, you know. And I said to him, and we all had a right laugh about this. I said to him, I said, you know, Mr. McGrain, I've done my due diligence. I've done all my homework. I've got all the basics, so don't worry about that. I understand everything you're going to explain. I says, and I've read some of your articles. I says, and I'm pleased that I've got you. I said, because you deal with a lot of other types of cancers in your practice. Breast cancer, you know, lung, all the rest. I said, so, you know, it will help your experience with potentially my treatment. He says, oh yeah. He says, I was going to do an Irish accent, but it's not that broad. Just a gentle accent he got. He says, yeah. He says, we have a lot of crossover in our treatments. So I says, yeah, and that pleases me. I says, so he says, and then he says, oh, I'm glad that it pleases you. He says, at least you're not saying you want somebody else to look after you. He says, because I won't be very happy. And we all cracked up laughing. Because there was this other guy, and I think he said he was the registrar doctor. A guy named Ben, and he's only there on like training, I guess, for 4 months, he said. And so after a fairly short chit-chat, which I'll tell you about, the consultant buggered off because, you know, obviously he's very busy. Nice guy. And left me with Ben. And Ben then went through everything, answered all my questions. And I'm not going to go through all that. Not in detail anyway, just the salient points. What he did say, he says, we've got your results of your PET scan. Not good. He says you've got, it's metastasised in your body, which means that it's created tumours elsewhere. He says they're all on your spine. So you got 3, and I think he said bone 10 or something on your spine. You've got 3 there. This is more or less just down below your shoulder blades. And then you've got one right at the lower end of your spine, just at the top of your pelvis. And I've been getting a little bit of sort of muscle pain there, but nothing unusual for a tall butt guy. And I've had no pain on the back. Nothing. Don't notice there. And then he says, and it's in your lymph node, in your pelvis. He says, so he says, our limit is 4. He says, and, you know, with the lymph nodes and things, he says, can't treat you with radiotherapy. It's too many. Be giving you too much radiation, and it, you know, wouldn't do you any good. So, you know, he says the options are to get you straight onto HRT as soon as possible. And then he said it's not HRT, it's hormone therapy, not hormone replacement therapy. Because what it is, it's a drug that stops the testosterone. So it's not replacement, it's hormone removal therapy. Stops your testicle, I can't think of the bloody word then. Stops your testicles working, stops all the testosterone, and stops feeding the cancers, and then potentially dies, which kills the cancers off or vastly reduces the numbers in your body, which is, you know, good. But it only works for so long. And then the cancers start to realise what's happening, the ones that are surviving, because the mutations that are there that can survive, survive, and will then start to mutate, and then they get clever and they start producing their own testosterone. So there's what's called a second generation hormone treatment, and I'll get this wrong. Oh dear, it's something like Ardent. No, I should have got the paperwork. But anyway, basically, it's designed to go into the cancer cells and stop them producing testosterone, so hopefully kill them off more. So what they're normally doing when it's severe, like I've got, and it's the worst of the worst, basically. If you get advanced cancer, it's all right if you got, less than 4 or 4 or less, because they can then zap them with radiotherapy, and it's an extra tool to kill them off. But I ain't got that luxury, unfortunately. So the idea is that this second generation goes in and kills the, stops them producing this extra testosterone. So what they do, because there's some of the normal cancer cells still floating around your body, they give you first generation hormone therapy. They give you second generation combination, they call it, therapy, which is the best chance, because it's a fast acting then. Or I should explain that there's a procedure where if it's not that severe, in sort of much less severe prostates, they'll give you the first generation first, which will normally last 1 to 3 years, and then they'll move on to the second generation once that stops working. And they monitor all this by looking at your bloods and the PSA's numbers. So they'll look to bring the PSA number right down to 0 almost, and then watch and wait for it coming back up. So at that point, it's going to start, the cancer cells are going to start multiplying again rapidly. And the type of cancer I've got is the rapid one. So they have to move quickly. And basically, there's a number of the second generation drugs, and they swap you about. I think it's about 4, and there's actually now they developed a third generation for people like me, where if all else fails, they give you the third generation, and it just gives you a few months more, where it stops the cancer cells, but it doesn't work that well. Only for a short period. There's then what I think it's called lutetium 177 and palladium 256, which I think I've explained before. It's similar to PSMA PET scan. It's this liquid where one side of it's designed to attach to the, this liquid, this marker that's on the cell, and the other side then attached to the radioactive element. Excuse me. And they emit radiation for a much longer period of time. I think about half-life of 6 months, I think. And the idea is it attaches to that cell, a cancer cell, any of that's got the marker, and that's the problem, because now some of them are not getting the marker on them. They're learning, you see, mutating, and it's the marker that's killing them, so let's stop using the marker anymore. So they stop emitting this chemical, the PSA. Yeah, so what that liquid does then is it irradiates the cell that it's attached to, and any around it. So if you've got a clump or gathering of them, obviously it destroys them using radiation. But of course it's quite potent, nasty stuff, and it's end of life, gives you probably an extra 6 months. So if I live that long, I might be getting it. Obvious question comes up, how long have I got? Had a bit of debate over it, and I've thought about it overnight, and yeah. It said 5 years. Straight up, 5 years you've got. So I said, yeah, right, but 5 years, what's the percentages? He says, and then he said, well, about a third 30% survive beyond. Now, what that tells you, it's a curved graph. And it starts now at 0, because I'm alive, I'm fit, I'm well, I'm healthy, I've no pain, no ill effects other than the peeing situation. Now, of course, the graph doesn't go along at 100% for 5 years and then suddenly go bump and everybody drops off the edge. I don't know why I'm chuckling. Life's rich tapestry. That's what this is. It's all about, living your life and getting every squeeze of an ounce of enjoyment or pleasure, whatever. So enjoy the bird song when you hear it, enjoy the sceneries, enjoy the company, enjoy your friends, your family. So this graph obviously goes down and down and down and down. So there's people that's going to die in the first year or so. And this registrar did say, he says, look out in the waiting room. He says, you'll see guys that can hardly walk, in wheelchairs and things. He says, and they're just getting diagnosed. He says, look at you, you're fit, healthy, you could walk 10 miles, whatever. So, you stand a good chance of getting to the end. But it's a little bit disconcerting. Anyway, so effectively, it's a chemo, if you're willing to take it on. So I says, absolutely, sign me up for it now. so he'd already got all the paperwork, the sheets and things out. So the hormone therapy, basically, and he starts rattling on all this stuff about, so my head was really going around a bit and didn't take it all in, but he gave me enough paperwork to read after, So the hormone therapy, basically, he said, you have to take, I knew this anyway, but he said you have to take these tablets 7 days before you start. You have your injections at your local GP. When you get your injection, it stimulates initially before it takes effect. It says, so you have a massive spike in testosterone in your body. It says, so we have to stop that because all that does is it feeds all your cancers and makes them grow rapidly. It says, so we give you this suppressant for you take it 7 days before. It says, so go to your GP and book an appointment. Start this 7 days, and I went to my GP on my way home, booked an appointment to have the injection a week yesterday, and I took my first tablet as soon as I got home. I want to get on it. But it's the same drug that, this is me, he didn't say this, but it's the same drug that makes, if a man wants to become a woman, it's a chemical castration. So effectively you start losing, all the sort of body hair, becoming female, if you've got a hairy chest. Have a sip of tea. And I expected this to be a bit short, but anyway, I'm going through the detail. Yeah, you become more emotional, all sorts of things, put on weight, grow breasts. So all these things I've got to start taking tablets and patches and things for estrogen patches. And they've not said that, I know that from what I've learnt. So it says you have an injection. The first one's for a month, I'm guessing, to see if you can take it all right. And then in a month after that, you go back and you have one then for every 3 months, which is about, gives me what I want in terms of, a spell of time in between, so I can go off in the motorhome and, France and Italy and wherever I want, while I'm able. While I'm able, the multi-gym comes today, but I can't lift it, I can't erect it, and I can't use it, which is a bit, because this bloody tape. So I'm going to be putting into this situation where all my muscles are going, I'm going to be feeling fatigued and tired, and I can't really do the things that will help me for a number of weeks until my prostate stops bleeding. And it has stopped bleeding, by the way, or it's reduced heavily overnight, which is a good sign. That scab's healed back over. Yeah, so then he said, chemo, he says, we'll have you on it within 2 weeks. As soon as possible, get you on the chemo. So, they've been very diligent. And then he starts saying, white blood cells, red blood cells, all these issues that can occur as a result of the chemo, nasty stuff. Mouth ulcers, your nerves on the end of your feet and fingers dying, being destroyed. Loss of taste, which Prince Charles, or King Charles I should say, sir, my lord. Yeah. Anyway, it's what he's suffering, so he's obviously on this chemo of some sort. But they're very diligent. You go in, have this sit down and have this intravenous. I think he said 4 hours, 3-4 hours. And then they monitor you and they're looking for, any ill effects. But they do an interview and blood tests and things before they give you the next round. And basically it's 6 rounds of this nasty stuff. It accumulates in your body over the 6. So as you get to the end, it's the worst. It's the worst in terms of ill effects. You get used to it being taken, so you're not vomiting or feeling as nauseous as you do with the first one. You get accustomed to it. That's the word I'm looking for. So rich tapestry of life. Here we come. So, itchy nose. Stop doing that. So it's 6 cycles, 3 weeks between each cycle. What he did explain is that you'll feel like crap for the first 2 or 3 days. But then what is happening in your body, and my tea's going cold, so I must drink. It affects your lymph. Anyway, it kills off a lot of your white blood cells, which, for those of you not medical, are the cells that attack infection. He says, so you've got to be very, very diligent for infections from day 7, because that's going to be your low point for white blood cells, and then your body will start to recover over 3 weeks. He says, and when you come in, we do a blood test immediately and check your white blood cells to make sure you've got sufficient for your next bout, next cycle. If you haven't, they give you an injection or something that makes your body produce more white blood cells, I should say. Because I think your white blood cells come from your bone marrow, and of course prostate goes into your bones. It's in my spine. Nasty. So anyway, so it says 6 months chemo. You could be in hospital for, depending on what happens and, how you take it. He says you could end up in hospital for a week. Being sort of treated to bring you back from the poison they've given you. So we had a long discussion over Jenny, my wife, because obviously I'm caring quite heavily for her, but she's improving a lot. But she's still got to go to the hospital fortnightly. And I'll not go into that detail, but, super bugs in her ear and, not good. But she's stoic, getting there. So anyway, 24 minutes, bloody hell, doesn't it go by quick when you're nattering? So as I said, I'm fit, I'm relatively, will tuned into it, you know. As soon as I can, I'm gonna start doing my exercises on my gym and getting the benefit of what I paid for. Doing my walking, and it's to the limit of what my healing prostate will allow. And then I'm going to be backwards and forwards chemo, so not sure when I'll do the next one. Might be after my injection in a week. I try to do it about weekly if possible. But the thing you might be pleased about, really, really pleased about, is all these are going to end in 5 years. I won't be doing any more. So, yeah, well, you got to laugh, haven't you? So, you know, you won't have to watch any more. Bro, sis, or sisters. Anyway, love you loads. And I know you love me loads. And it helps. I better not, I'll start bloody crying in a minute. So, yeah. So I said to my wife, travelling home from about an hour's drive from Truro, I said, I can rob a bloody bank. And I'll only get 5 years. So, I said I can commit murder. Mind you, they don't get much more than 5 years for that nowadays, do they? Yeah. Anyway, I think that's sufficient. And, yeah, don't feel down. Don't be upset, you know, Lynn. I'm still compis mentis. I'm still here. I'm still I'll bloody, you know, make things crack and I'll enjoy my life full. Even had a beer last night. Whoo! So, you know, we'll enjoy it best we can. Obviously, we had the discussion about quality of life and treatment. And bearing in mind, I've got good quality of life, no issues, and I'm going to put myself into 6 months of, you know, severe chemotherapy. And that's the issue, innit? I mean, you can keep having chemotherapy, but at what point do you want to put yourselves, you know, if you've only got 6 months left, do you want to put yourself through 6 months of shit? You know? And this is what you were saying, is you reach a point where it's diminishing returns, and, you know, it's not worth the reduction in your quality of life. You know, and they've gone through it, they're doing it every day, aren't they? You know. Anyway, just short of 30 minutes, so I'm going to finish my tea before it gets too cold. Yeah, so I'm guessing it's coming up 4:30 now. Dawn hasn't brought yet. So, love you all, keep watching, and please subscribe. Go right back to the first one, and, you know, you'll see my life history. And especially Graham, you know, the guy I met. We're communicating now and he's sending me emails and things. Thank you, Graham. Thanks for that. That photo, brilliant, beautiful. So, you know, you make new friends in life. And, nice guy. Yeah, so anyway. You never know, you might be watching this and I won't be here anymore. Yeah. Oh, I shouldn't be like that. Just me dark sense of humour, I guess. Okay, right. Love you all loads, and you know that. And if you're not family, you know, and you're getting some benefit from this, it will make my heart burst with joy. Anyway, right. See you again. We're on the road. We know where we're going, and, you know, don't know when quite we're going to get there, but, you know, funny set of circumstances. But anyway, time for a philosophical debate. Yeah. Right. I hope you're enjoying it. Let me know if you are. It helps. Cheers. Bye for now.